Hepatitis. Introduction. Which of the following is a function of the liver? Choose one of the following options. 1. Cleans toxins. 2. Processes fats and sugar. 3. Makes blood clotting substances. 4. All of the above. Correct. The liver performs all of these functions. It also makes bile. Hepatitis is inflammation or swelling of the liver. Select true or false. Correct. Hepatitis often causes inflammation or swelling of the liver. This prevents it from working well. Which of the following prevention methods can help prevent hepatitis A? Choose one of the following options. 1. Vaccination. 2. Avoiding tap water when traveling abroad. 3. Practicing good hygiene. 4. All of the above. Correct. Hepatitis A can be prevented in a number of ways. The people most at risk for hepatitis B and D are people who come into contact with blood. Select true or false. Correct. Hepatitis B is carried in the blood of an infected person. Hepatitis D only happens in people who already have hepatitis B. Mark received a blood transfusion after he was involved in a car accident in 1993. Is Mark at risk for hepatitis C from having had this blood transfusion? Select yes or no. Correct. Mark received his blood transfusion in 1993. This is after the time when healthcare providers started screening blood donors for hepatitis C. He is not at risk due to the blood transfusion. People must be vaccinated against hepatitis E. Select true or false. Correct. There is no vaccine approved for hepatitis E, but the infection usually clears on its own and does not need treatment. It can be prevented by avoiding exposure to the virus. A liver transplant is the best option for people seeking treatment for hepatitis caused by alcohol consumption. Select true or false. Correct. Liver transplants are rarely given to people who are at risk for drinking large amounts of alcohol after the transplant. There are not enough livers for transplant to help everyone who needs one. They are given to patients who are low risk for drinking alcohol after the operation. Thank you for using Explain.